Hi class, my name is Olivia Owens, and for my research article presentation, I will be reviewing an article on the self-management support by final year nursing students. This is a correlational study on the performance and associated factors of nurses and their ability to support patients and the self-management of their care. As most of you know, chronic conditions place a heavy burden on the healthcare system. So it is very important that patients are encouraged to take an active role in managing their care. This includes self-monitoring, home care, reporting, and working closely and communicating with their doctors in order to manage their care. So it is essential that nurses and healthcare professionals support patients in managing their care in order for patients to be successful. At the time, there was no evidence on final year nursing students' performance in supporting patients' self-management. There was also no research on the factors associated with having this skill and being competent. So the purpose of this study was to explore the performance of final year nursing students in supporting self-management and to identify the associated factors with this skill. So some of the questions that the study was looking to answer is, do graduate nurses possess the skills to support patients in self-management? And what characteristics are required for competency in this skill? And if the graduate nurses are not competent, what needs to be done in order to prepare nurses for this role? This study followed the concept of the 5 A's model to assess, advise, agree, assist, and arrange. This model outlines the activities that are needed for nurses to support the self-management. For this study, theoretical behavioral frameworks were used to select the hypothesized factors. The first theory was the social cognitive theory, which focused on self-efficacy, which is the belief that one has in their own ability to accomplish future tasks. The second theory is the self-determination theory, which identifies 3 basic physiological needs as predictors of individuals' optimal functioning. This includes autonomy, which is experiencing a sense of psychological freedom, competence, which is feeling effective, and relatedness, which is feeling loved and cared for. These 3 things are what leads to optimal functioning and well-being. It also focuses on contingent self-esteem, which is the tendency to hinge one's self-esteem upon the achievement of others. So this could be a nurse hinging their self-esteem upon the success of their patient. And the third theory is a theory of planned behavior, which means that if you have a positive attitude towards something, it makes you more likely to perform that behavior or task. Okay, sampling of the study was done by recruiting for final year nursing students from 8 Flemish nursing schools. 5 of the schools were undergraduate programs and 3 were vocational programs. All of the subjects were selected using a convenience sample, which means that all of the students were selected to participate in the study. All of the students were invited to participate prior to their final year internships. 557 nursing students were sent an invitation and 339 students actually participated in the study. Data for the study was collected between January 2015 and May 2016. The data was collected using a self-administered paper questionnaire, and each student was given 2 different questionnaires. The first one was administered prior to starting their internship, and the second one was a completely different questionnaire that was administered within 1 week of completing their internship. The students were unaware of what was going to be on that second questionnaire, as it was completely different from the first one that they took. All of the surveys were completed in the classroom setting. Excuse me. And all students were informed of the purpose and the methods of the study and were required to sign an informed consent. The questions of the questionnaire were all scored using a 5-point Likert scale. Data analysis was performed using t-tests for the independent student analysis and using ANOVA for multiple or two or multiple group analysis. An alpha level of 0.05 was used, and the researchers were also careful to exclude any questionnaires with a repetitive response pattern or questionnaires that were missing 10% or more of the items, because this shows that the questionnaires were answered haphazardly and that could produce a bias in the results. Out of the 339 students who participated, 256 were included in the analysis after exclusions, because some of the questionnaires were excluded for a repetitive response pattern and some were incomplete. So just a little background on the characteristics of the participants. 82.8% were female and 54.3% were younger than 23 years old. So this shows that the population of the study was mainly female and a majority were pretty young. 10% also lived with a chronic illness themselves, and 39% had a close relative with a chronic illness. So these students were already familiar with the support and the care that is needed and required for self-management. The mean self-reported performance score was 11.58 with a standard deviation of 3.99, and the range for the scores was 0 to 24. So this score is pretty low. Using linear regression, researchers were also able to predict student performance in self-management of support. And the equation is listed there, and it does show that we can reject the null hypothesis that graduate nursing students do have the competency to support self-management of patients. The results of the study clearly show that final year nursing students are not ready to support patients in self-management. Overall, the students reported low performance levels in all areas of the activities that are required in self-management. Some limitations to this study include the convenient sampling method because it does not represent the population. It's very specific to the Flemish nursing schools, and also this sample was biased because a majority was female and a majority was very young, so it wasn't a very good representation of the population. Excuse me. Also, non-attendance may have led to bias, meaning that students who were interested in the study are the ones that are going to participate, so that might create a bias in the results. And also, self-reporting may lead to overestimations because, whenever you answer questionnaires, you always tend to think more highly of yourself than you may be in actuality. So in conclusion, as the number of people suffering with chronic illnesses continue to rise, self-management is becoming even more important as the burden that is placed on the healthcare system increases. We need patients to take a more active role to be able to assist and communicate with their doctors in order to provide the best quality of care that we can. So it is essential that graduating nursing students are competent in supporting patients in their self-management. So in order to increase their performance, students need to be confident in their skills. They need to be knowledgeable in how to support their patients and how to meet their needs, and helping them to take an active role in managing their health care. So what we can do is to implement more training and more education in nursing programs to specifically emphasize the skills that are needed to support self-management. Okay, and there is my reference. It was from the International Journal of Nursing Studies. I thank you for your time, and I hope you have a great day. Thank you.